Hey there, today we're diving into the fascinating world of brain injuries and the ripple effects they can have on our minds and bodies. Let's start with some of the more well-known players like mild traumatic brain injury or concussions, which can cause temporary confusion or loss of consciousness. But sometimes things get a bit more serious, leading to intracranial hemorrhages, think subarachnoid or subdural hematomas that can cause intracranial pressure and threaten brain health. Now, one particular sneaky condition is chronic traumatic encephalopathy, or CTE. It's like the brain's own detective story, with four pathological stages ranging from mild to severe, marked by tau protein buildup, specifically p-tau, showing up as neurofibrillary tangles, especially in frontal, temporal, and limbic areas like the hippocampus and amygdala. These changes can lead to cognitive dysfunction, including memory loss, executive function problems, and behavioral changes. Trauma can also cause diffuse axonal injury, a kind of widespread damage to the brain's white matter, leading to axonal dystrophy and neuronal deficits. Imagine the brain's wiring getting a bit frayed. This can show up as cortical thickness and volume reductions in key regions like the superior frontal gyrus, entorhinal cortex, and even deeper structures like the hypothalamus and mammillary bodies. These anatomical changes often correlate with impairments in episodic memory and neurobehavioral dysregulation. During injury, the brain's neurochemical balance can go haywire. Excess glutamate may cause exotoxicity, while altered glucose metabolism and lactase buildup reflect a hypoglycemic state. Kind of like the brain is running an emergency power surge, functional connectivity between regions can be disrupted, affecting everything from sleep cycles to neurotransmission and leading to symptoms like delirium, seizures, or even organ failure in extreme cases. When evaluating brain trauma, clinicians often rely on neuroimaging biomarkers like CT scans and angiograms. These reveal microscopic changes such as enlarged lateral or third ventricles like cavum, septum, pellucidum, or decreased brain weight. Certain brain regions are especially vulnerable. The occipital and temporal lobes, including the superior temporal gyrus, orbital frontal cortex, and parahippocampal play key roles in cognition and behavior. In the realm of neurodegeneration linked to trauma, tau pathology, also called topathy, is a big focus, especially with markers like phosphorylated tau. These pathological hallmarks are often found in the frontal and temporal lobes, including olfactory bulb and hippocampus, further contributing to dementia-like symptoms. Addressing these issues involves a comprehensive approach using analgesia, substitution algorithms, and neurobehavioral evaluations to manage symptoms and support recovery, but it's a delicate balance as trauma and neurodegeneration can lead to long-term functional dependence and cognitive impairment. So whether it's a mild bump on the head or severe injury involving diffuse axonal injury, understanding the complex cascade of neurochemical, structural, and functional changes can help you better appreciate the resilience and vulnerability of the human brain. Remember, early detection, intervention are key to help the brain heal and regain its spark.